During pregnancy and when nursing, women are more careful than ever about what they consume.
I make a point to eat healthy foods and drink healthy beverages while I'm pregnant because it's something that I can control and it's easy and I know it will affect the health of my baby.
Certain foods and beverages, like alcohol and caffeine, may be easy enough to avoid. But what should women do when they don't feel well? How safe is it to take over-the-counter or OTC medicines during pregnancy or when nursing?
I'm just going to check on that back pain. Which part of the back is most uncomfortable? Maybe we can just point to it.
Sure.
Right there.
Lower left, I guess.
Lower left.
What's the best advice for taking medications while pregnant or when nursing? First and foremost, pregnant women and nursing moms should talk to their doctor or healthcare provider before taking any OTC medicines. They are in the best position to provide guidance on OTC medicine use.
Generally speaking, pregnant women should not take medications during pregnancy, even over-the-counter medications. Sometimes, though, the benefit of the medication outweighs the potential risk. It's important to check with your obstetrician or midwife to see if that applies in your situation. The first trimester, the first third of the pregnancy, is a particularly vulnerable time. That's when the organs of the embryo and then later fetus are developing, when they're most susceptible to anything, including medications.
But at the same time, women don't need to suffer through symptoms.
Generally speaking, we encourage women not to take the medications if they don't need them. However, there's no need to suffer unnecessarily. So after consultation with your obstetrician and or midwife, it is safe to take most over-the-counter medications. And it's important to remember to limit the dose and limit the duration, and of course try alternatives, non-medical alternatives whenever possible.
In general, experts say to follow these guidelines for safe OTC medicine use during pregnancy or when nursing. Always consult your doctor or healthcare provider before taking any OTC medicines. Start by taking the lowest recommended dose and take only what is needed for symptom relief. Do not use aspirin or aspirin-containing products during pregnancy. Avoid nonsteroidal anti-inflammatory drugs such as naproxen and ibuprofen, especially during your last 3 months of pregnancy. Acetaminophen is generally safe for short-term pain relief throughout pregnancy, including during the first 3 months of pregnancy.
Hi, Abigail.
Hey, Dr. Keefe, how are you?
How are you feeling?
Pretty good.
Everything going well?
Yeah, everything's
For some of the most common pregnancy symptoms like heartburn, indigestion, and constipation, there are many safe over-the-counter options that can provide relief.
Heartburn can be treated effectively with antacids, which are safe during pregnancy. Constipation can be treated conservatively with bulk fiber, either dietary or taken as an over-the-counter medicine, as well as stool softeners, and these are all safe during pregnancy.
Like other symptoms pregnant women experience, having a cold can be very uncomfortable, especially during pregnancy.
I've been having a cold this week. My throat's really hurting.
Okay. Is there any fever?
No.
You don't have any chills?
No.
Any difficulty breathing? Shortness of breath?
Not really.
Before taking any over-the-counter cold medicines, you should talk to your doctor. He or she may advise you to drink fluids and rest as an alternative. If you have any questions about whether a medicine is safe for you to take during pregnancy or when nursing, be sure to ask your doctor. Your doctor is your best resource for questions about OTC medicines during pregnancy and when nursing.
When I take an over-the-counter medication, I'm really careful to read the instructions on the back for the dosage, and I always ask my doctor first to make sure that she's all right with it.
So it's nice and strong, steady.
Remember, you don't necessarily have to suffer through your symptoms just because you're pregnant or nursing. But be sure to talk to your doctor before taking any OTC medicines. It's the best way to make sure that both you and your baby stay healthy. For more information and free brochures, visit otcsafety.org.